My name is Benjamin Ghiam. I am an American board certified ophthalmologist. I did additional training, fellowship in neuro-ophthalmology and strabismus surgery. I practice here in Los Angeles, where I do both clinical and surgical work. Yeah, I think one of the biggest complaints I'm getting in my office is issues with eye fatigue, eye strain, chronic eye pain. These are syndromes that many providers don't quite know how to approach. Many patients aren't quite aware of their condition when they come in. And it takes a lot of patient education and counseling so that they're aware of what their symptoms are and that they're aware that there are treatments available to help fix these symptoms. I really do think we are in the throes of what I would call the blink epidemic. And what's going on is with this increased demand of screen time, whether this is part of your job or just what you like to do on the side, or you work in tech or finance, you are behind a screen more hours than not. And what's going on is your blink rate is significantly reduced. You're blinking a quarter of the time as you normally should. 20 times a minute has become 5 times a minute, sometimes less. And with that exposed cornea, your tear film starts to get disrupted and the surface of the eye gets dry and it can't quite catch up. The more you blink, the more you try to replenish that eye, but now you're kind of stuck and starts to get the symptoms of dry eye, the fatigue, the irritation. Your visual acuity starts getting compromised because you can't focus right. So we could talk about the vision changes that happen from dry eye, which is a more concerning symptom than just the sensation of dryness. No, yeah, it compromises your functional capacity. You can't do your normal activities of daily living if you don't feel like you can see well. I do have many patients who don't feel safe driving just because their eyes are so dry they can't focus right. This would be the equivalent of the windshield of your car. Kind of when it's raining and you have dry spots everywhere, but you don't have a windshield wiper to clean that. Well, you can't really see right.
You're going to crash and you're going to...
You can't function. You can't. Yeah, no, certainly. Dry eye can result in eye pain, chronic eye pain, which causes referred pain and chronic headaches. I see this all the time. You can have chronic pain and chronic eye pain and chronic headaches from untreated dry eye. It becomes a neuropathic eye pain. So I think one of the most common things is a patient comes in and says, my eyes feel tired, my eyes feel irritated, uncomfortable, and they're always red. And I'm saying, well, what eye drops are you using? And then they'll hold up some sort of Visine or some other similar redness reliever. And here's the biggest issue. Something that's designed to be a redness reliever isn't necessarily lubricating the surface of your eye. It's just designed to mask the symptoms of redness by constricting your blood vessels, really. It's got plenty of preservative and other chemicals in that drop that's worsening the surface of the eye. So your symptoms will get worse. Maybe in the beginning the redness will get improved, but down the line the redness will come back from rebound and your eye will be worse overall from a comfort standpoint. Our eyes were never designed to stare at these brightly LED lit screens for hours and hours on end. Not only does that light have an effect on drying out the surface of the eye, but the main mechanism is the reduced blink frequency. This happens when you're behind your phone or a laptop or a TV screen for an extended period of time, but also if you're driving or focusing on something intently, your blink rate drops, less than 5 times per minute versus 20 times per minute when you're normally functioning. Now, when you're not blinking, you're not replenishing that tear film. It evaporates. We call this evaporative dry eye. When you're not blinking, the tear film dissipates and the surface of the eye gets dry, resulting in the symptoms we discussed, the irritation, the discomfort, the sensation that my eyes are just tired. When you're working behind those screens, you drop the blink rate, you get those symptoms, and the only way to treat that, because look, we're not about to stop working. We're not about to get off our screens. We have to find a way to cope with the lifestyle we've decided with. So the only way to manage this is by using eye drops to help treat these symptoms. And these eye drops are safe. You can use them daily. And actually the recommended dosing is that you use these eye drops daily. Up to 4 times a day is the recommended dosing for this. And you don't want to chase your symptoms. You don't want to wait for the dryness to settle in, and now you're chasing your symptoms with the eye drops. You want to beat the symptoms. So you want to take this regularly, breakfast, lunch, dinner, bedtime, for example, to help treat these symptoms.